If you've heard PEMF therapy can help with chronic pain, inflammation, nerve pain, and faster healing, you might be wondering how one treatment can have so many different benefits. The answer isn't that it targets all of those problems individually. It works in a way that can influence many of your body's natural healing processes. In this video, I'll explain what PEMF is actually doing inside your body, why it may affect everything from pain and inflammation to healing and recovery. I'm Dr. Cordova. I've been a chiropractor for over 29 years, located here in Houston, Texas. I've helped thousands of patients with disc bulges, sciatica, and leg pain get their life back without surgery. Before we get into how PEMF therapy works, let's talk about what we commonly use it for. In our clinic, it's commonly used as part of a treatment plan for conditions such as chronic pain, disc bulges and disc herniations, lumbar spinal stenosis, degenerative arthritis, chronic low back pain, sacroiliac or SI joint pain, hip pain, lumbar radiculopathy and sciatica, neck pain, and arm numbness and tingling. Now, these are all very different conditions, so how can one therapy be used for all of them? To answer that, you first need to understand what PEMF is actually doing inside your body and what it is. PEMF stands for Pulsed Electromagnetic Field Therapy. It uses carefully controlled, low-frequency electromagnetic pulses to deliver energy into the body's tissues without producing heat or causing damage. During treatment, a specialized device generates magnetic fields that pass through the skin, muscles, and even bone, reaching cells throughout the targeted area. Unlike electrical stimulation, which sends current through the skin and can cause muscles to contract, PEMF relies on magnetic fields that move through tissue comfortably and non-invasively. These magnetic pulses create tiny electrical currents inside the body, which interact with the natural electrical activity that already exists within your cells. Every cell depends on electrical signals to communicate and function properly. PEMF is designed to influence these signals by providing gentle electromagnetic pulses that support normal cellular communication. This is the fundamental technology behind PEMF therapy and the reason researchers continue to study it for a wide variety of musculoskeletal and neurological conditions. Now that you understand the technology behind PEMF, the next question is, what do these electromagnetic pulses actually do once they reach your tissues? Rather than producing one single effect, it influences several normal physiological processes that your body relies on every day. Those changes can affect how you experience pain, how well injured tissues receive oxygen and nutrients, how inflammation is regulated, and how efficiently your body repairs itself. One of the biggest reasons people try PEMF therapy is to help reduce pain. Your nerves use tiny electrical signals to send pain messages to your brain. When an area is injured or irritated, those signals can become stronger and more frequent. Sometimes they keep firing even after the tissue has started to recover. PEMF therapy creates gentle electromagnetic pulses that interact with these natural electrical signals. Researchers believe this can help calm overactive pain signals, making them less intense before they reach the brain. Think of it like turning the volume down instead of muting the sound completely. PEMF doesn't simply hide pain like a pain medication. By helping calm irritated nerves, it may make it easier to move, exercise, and take part in treatments to help fix the underlying problem. For someone with a disc herniation, that may mean less pain coming from irritated tissues around the disc. For someone with nerve pain like sciatica or peripheral neuropathy, it may help calm irritated nerves that are sending constant pain signals. And for people living with chronic neck or low back pain from arthritis or spinal degeneration, reducing these pain signals may make everyday activities feel more comfortable and improve their ability to stay active. PEMF also helps with reducing inflammation naturally without medication. Inflammation is a normal part of healing. When you get injured, your body sends more blood and healing cells to the area to start the repair process. But if inflammation lasts too long, it can lead to ongoing pain, swelling, and stiffness. PEMF may help by increasing the release of a natural substance called nitric oxide. Nitric oxide helps to relax and widen your blood vessels, allowing more blood to reach the injured area. That improved blood flow helps deliver oxygen and nutrients that support healing, while also helping carry away waste products that can build up and damage tissues. The result is a healthier environment for your body to recover. For someone with a recent muscle or ligament injury, this may help reduce swelling. For people with arthritis, it may help calm ongoing inflammation inside painful joints. And for someone recovering from a disc injury or sciatica, reducing inflammation around irritated nerves may help ease pressure and improve comfort. Instead of simply trying to stop inflammation, PEMF helps your body regulate it more effectively so healing can continue. PEMF can also help with bone healing. Bones are living tissue, and after a fracture, your body starts building new bone cells to bridge the broken area and make the bone strong again. Sometimes that healing happens quickly, but in other cases, the process slows down or even stops. PEMF therapy creates a gentle electromagnetic pulses that stimulate the cells responsible for building new bone. This encourages the body to continue the natural healing process, especially when healing has stalled. In fact, PEMF is FDA approved for treating certain fractures that haven't healed properly, called non-union fractures. It's one of the few uses of PEMF with this level of medical approval. While most people receiving PEMF in a chiropractor or rehab clinic aren't being treated for a broken bone, healthy bone is still an important part of overall recovery. For someone with spinal degeneration, stronger, healthier bone supports the joints of the spine. For someone recovering after orthopedic surgery, PEMF may help support the normal healing process. And for people with stress fractures or fractures that are taking longer than expected to heal, PEMF may help encourage bone repair when used as part of an overall treatment plan. Earlier, I mentioned that PEMF may help increase the release of nitric oxide, which relaxes and widens your blood vessels. But that's only part of the story. PEMF may also improve something called microcirculation. This is the movement of blood through the smallest blood vessels in your body where oxygen and nutrients are delivered directly to your cells. When microcirculation improves, injured tissues have better access to the oxygen and nutrients they need to repair themselves. At the same time, waste products from damaged tissue can be cleared away more efficiently, creating a healthier environment for recovery. For someone with a muscle or tendon injury, better blood flow may help support the healing process. For people with chronic neck or low back pain, improved circulation may help reduce muscle tightness and stiffness. And after surgery, healthy blood flow is an important part of delivering the nutrients your body needs as it repairs damaged tissues. PEMF also supports tissue repair. Your body is constantly repairing itself. Every day, it replaces damaged cells and rebuilds tissues that have been stressed or injured. One of the most important building blocks in this process is collagen. Collagen is a protein that gives strength and structure to tendons, ligaments, cartilage, and other connective tissues. Research suggests that PEMF may help stimulate the cells that produce collagen, supporting your body's natural repair process. This doesn't mean new tissue grows overnight. Healing still takes time, but by supporting normal cell activity, PEMF may help create the right conditions for damaged tissues to recover more efficiently. For someone with a tendon injury, this may help support tendon healing. For people with a ligament sprain, it may assist the normal repair process as the tissue regains strength. For individuals dealing with disc herniation or bulging disc, PEMF may help support the surrounding tissues and promote a healthier environment for recovery. And for those with arthritis or cartilage wear, PEMF may help support the ongoing maintenance and repair of the tissues that help keep joints healthy. PEMF may help promote relaxation and better sleep. This last benefit may not seem directly related to pain or healing, but it can make a big difference in how you feel. When you're dealing with ongoing pain, your nervous system can stay in a constant state of alert. That can make it harder to relax, harder to sleep, and more difficult for your body to recover. PEMF therapy may help calm the central nervous system and reduce the release of stress hormones. Many people report feeling more relaxed after treatment, and some notice improvements in their sleep quality over time. Better sleep isn't just about feeling more rested, it's when your body carries out most of its many important repair processes. The better you sleep, the better your body is able to recover from injury and manage pain. For someone with chronic neck or back pain, sleeping more comfortably can make everyday activities easier. For people with persistent nerve pain, helping the nervous system settle down may improve both comfort and sleep. And for anyone recovering from an injury, good quality sleep gives the body more opportunity to heal naturally. Now you have a better understanding of what PEMF therapy is, how it works, and the 6 ways it may help your body from reducing pain and inflammation to improving blood flow, supporting tissue repair, helping bones heal, and even promoting better sleep. I'm curious, which benefit surprised you the most? Was it how PEMF helps relieve pain or how PEMF supports tissue repair? Drop a comment below and let me know. And if you found this video helpful, please give it a like and share it with someone dealing with back pain, neck pain, sciatica, arthritis, or another musculoskeletal condition. Doing that helps more people find practical, non-surgical treatment options that may help them move better and feel better. And remember to subscribe to my channel if you want practical, evidence-informed videos on pain relief, movement improvement, and the exercises and treatment strategies we use to help patients feel and function better. Now, if you'd like to see how PEMF therapy fits into our complete 5-step treatment approach for disc bulges, sciatica, lumbar spinal stenosis, back pain, and neck pain, watch this video next. In it, I'll walk you through the 5-step process we use in our clinic and explain how we help patients achieve fast, lasting relief. Go watch this video next.